When I was a child, I had the privilege of being raised by a family of very artistic people. People who taught me to play, to create, to dream, but most of all, to make connections. And those people, like my mother and father, they used, for example, to paint with me and draw. And both my grandfathers, especially my mom's dad, he used to build models with me. He bought paper cards and cardboard, and we used to build ships, castles, houses, even imagine tents of circuses. Life was great until I was 5, full of color, creativity, and passion. But then a door opened, and my grandfather, who was a mentor to me, went through it. You see, he was a chronic kidney disease patient, already in dialysis and with a heart comorbidity. Back in 2003, he decided to do a surgery, hoping to get some more years of life. But unfortunately, despite the fact that the surgery went really well, he got a bacteria in the hospital, and so we lost him. It was a great blow to my family, and soon after, worse news came. We discovered that my mother had the same kidney genetic condition as my grandfather. So I started feeling this weight over my shoulders with 5 years old. I started feeling that my paper castle was fragile, that time was short, and I could probably see my mother do dialysis at a very young age. And so I needed to do something. I needed to have some kind of purpose to help my mom and to help my family. And so I did what probably many kids would do. I started doing my best at school. I studied math, sciences, religion, politics, anything you can imagine. And actually, I loved it all. And in most of those subjects, I was quite good. But you see, that also created a problem, because when you love too many things at the same time, you may also feel scattered, that you don't have a clear purpose. And that's precisely how I felt until much, much later, when I discovered that my superpower was precisely where my grandfather had left me, in the ability to make connections. It was because of this ability to make connections that I later chose to go to the course of biomedical engineering, a course predicated into the idea that you can use creativity and connections between different areas of knowledge to create new ideas and new solutions that can help to save more lives. For me, it felt quite obvious, an obvious choice, and it felt inevitable. So you might get my frustration when I entered into university and I soon discovered that here in Portugal at the time, the National Engineers Association didn't recognize biomedical engineers. More, many hospitals didn't contract biomedical engineers as a regular practice. And for some clinicians, for some reason, it even felt strange, even awkward to have biomedical engineers around. So once again, my paper castle felt fragile, and I started questioning my choices of life. So in my second year of university, I found out that some colleagues of mine were building a platform to bridge clinicians and engineers and solve a bit of this problem. And so I joined that movement. And despite the fact that at the time I didn't had organized any kind of great event or even led big teams, that experience would completely change my life forever, and even change the way I see my superpower and also engineering. But before we dive into that, let me ask you, what is an engineer? Could you define it for me? Probably not. Many people can't define what actually an engineer does. People have this sense that an engineer is some creative person. But to actually understand the true nature of an engineer, let's dive first into what is a scientist. Well, a scientist is someone who pursues truth. Science is a pursuit of truth. An engineer is someone who gets the results of that pursuit and he uses those results to create new ideas, new tools into the real world. Tools that, in the case of a biomedical engineer, can help to save more lives. So you see, engineers have this superpower, the power of making connections. And today, I brought you 3 examples that show up why this is so important. My first example comes from a very unexpected place, probably, for you. So one of the problems that exists in hospitals, as I've already spoken, is precisely the spread of bacteria, as in the case of my grandfather. And you see, bacteria can spread across all surfaces, across the sheets, across the floor, across medical instruments. They are kind of a mess. And they put at risk mostly the patients who are most vulnerable. And so the usual response to this is to basically use chemicals. You use more chemicals, more cleaning, but that also means constant risk and also constant cost. So engineers could look at this and start thinking, well, why don't we, instead of using chemicals to solve this problem, why don't we create in the first place a material that basically repels bacteria? And so they went into creation. And many times in engineering, you don't need to invent the wheel again. So what you can do is look around and see what exists. And the biggest repository of ideas for engineers, do you know what it is? Nature. Nature is one of the biggest repositories of ideas that you can find. And engineers went into looking and they found that in a very special animal, there was a surface that could repel bacteria in sharks. Yes, sharks helping to save lives, we would say. And basically, they created a surface that can replicate this microstructure of the skin of the shark, and it is able to repel the bacteria. And they are reproducing this into hospitals, helping us save more lives. But that's not only in what regard to nature that engineers can find new ideas. They also can find new ideas by looking up into the stars, into space exploration. Yes, space exploration is not just some rich guy stuff that spend lots of money doing spacecrafts. Also, space exploration is also a great source of inspiration for engineers, and it has led to several solutions in the medical field. For example, one of those solutions is the Canadarm. Canadarm was basically a robotic arm capable of maneuvering large objects in the wastelessness of space. And basically, engineers looked at it and they start asking, why don't we use the same level of precision and adapt it into the rooms of surgery? And so they did it. And they invented the NeuroArm, the first robotic arm capable of operating inside an MRI machine, enabling medical surgeons to do, for example, brain surgeries at a level of precision that was unparalleled at the time. So through the stars, through nature, engineers find solutions, but more, for example, in our daily lives. And my third example is a very special example, and it's also a real one. It comes from a father whose child had cancer, which is probably one of the most difficult things that someone can go through. Unfortunately, his child didn't survive, but he decided to put his hands into work. He is an engineer. And basically, one of the problems that happens with children with cancer is that they have spikes of fever, and these spikes of fever can be very dangerous and put at risk the child. So what his father did was to create a device that could in real time monitor the temperature of the child and send the information back into the hospitals, connecting with the doctors and all the clinicians that were accompanying the child. And to build this platform, to build the software, he needed some kind of big cloud and a navigation system. And so he made a partnership with Embraer, the famous aviation company producer. And so a story that was very tragic started to build hope for children around the world. And engineers did all of this because of connection. You see, all the things that you see in the hospital, from the EEGs, the ECGs, the MRIs, the CT and PT scans, all that electronics in the hospital, that exists because of engineering. But yet, I suppose that you don't think about engineers when you think a medical team, do you? And one of the biggest facts that we have found during the platform that I was talking to you about, that we built in university, was precisely that when we bring up engineers into the medical team, we have reducing costs, we have more efficiency in treatment, in the services, clinicians are happier, and we get more lives saved. And for example, in our platform, we found out, for example, these three solutions we are testing now here in Algarve. They are basically solutions that we found out by connecting people around the world. One of them is able, the first one, to predict cancer in women, in breast cancer, by only using their blood sample through AI, of course. The second one is able to use AI to drive doctors so they can see through the patient during the surgery, even before opening, by basically using imaging and AI. And the third one is very special because the third one is one that can help my mom and was a solution that probably will help her live much more years without having the need to do dialysis. This solution is able to use AI to monitor her biomarkers and also her diet, and with that, she can have a much safer life and a safer choices that can help her live much more time without the need to do dialysis. So all of this happened because of connections. And this also happens not in particular cases, but at the level of hospitals. And we found out one case such as that in one hospital, which is the biggest network of oncology hospitals in South America. They basically have engineers working for them and engineering departments. And this helps them build their own technology to create new ideas for problems that they usually have and they find across the time, and also to improve the reduction of costs. And even they can use technology because they create their own devices and get this technology into places like the Amazon rainforest. That's basically why you have that truck over there. So my final message to you is that whatever is that you do in your life, always remember that life is more than just a playground of scattered boxes. We usually find neat little labels for everything, but we forget that the real magic, it happens in the space between the boxes. And as my father taught me, what makes a beautiful castle, a beautiful ship, is the ability to make connections, because it's connection which can save more lives. Thank you.